Hi Meg, how are you doing today?
Good, how are you?
Good. My name is Ryan. I'm going to be your nurse today. I'm going to perform hand hygiene and provide privacy for you. We are actually going to be doing your full head to toe assessment today. And I've already calculated your weight, your height, your BMI, your vital signs, which were all normal. Your blood pressure was around 120/80, which is normal. Your respiratory rate was between 12 and 20. Your temperature was 98.1, which is around normal. And then your pulses were between 60 and 100, which is normal. So we're going to start off by doing just like a general survey mental assessment. So first off, can you just sit up for me and then state your location?
Your apartment.
Okay, do you know what's happening?
Head to toe assessment.
Okay, and then can you tell me the date?
December 3rd.
Okay, and what's your name?
Megan.
Okay, good. So A&O times 4, which is good and what we expected. So then I'm also going to be just looking at your posture. Your posture seems to be erect, straight and relaxed, comfortable, which is good. Your hygiene is good. Your speech is not slurred, it's clear and cohesive. Let's see. Okay, and then we're going to just go ahead and move on to the head assessment. Okay, so on the head, we're just actually looking and making sure that it is normocephalic and it is the right size for her body. It's in the center. And then I'm going to palpate. Any tenderness? Okay, no tenderness, and her head is noted. And then I'm also going to check her hair and make sure that it is evenly distributed. It is like a light brown color and it's smooth, healthy, which is good. Okay, then after her hair, we're actually just going to do the face. So I'm going to look at her face and we're going to make sure everything's symmetric. So her skin seems clear and healthy and moisturized. Her eyebrows are arched correctly, both symmetric. Eyes are symmetric, no droopy eyelids. Nose is straight and symmetric. Lips are symmetric. And then your ears are also symmetric, lined up with your top of your ears are lined up with the corner of your eyes, and they are in the middle of your head. Okay, so good. We are actually then going to test your eyes. So if you could just look straight ahead at me. So we're looking at her conjunctiva, which is actually right here, and it is pink. There's no swelling. Any tenderness on your conjunctiva? Okay. Palpebral fissure is good. Sclera is white. There's no redness or yellowness to that. Iris is good, and cornea is intact. So then I'm actually going to have you look straight ahead at that mirror, and I'm going to test your pupillary light reflex to make sure they dilate. And they are equal, so they're equal, round, and reactive for your pupillary light reflex. And then I'm actually going to do the accommodation test. So you can just look at the pen and follow it. Okay, good. And then the 6 positions test. So just follow the pen once again. Okay, so 6 positions test, accommodation, and pupillary light reflex are good and intact, so that's good. And then the corner of your eyes are matched up with the tragus of your ear, so that's good. So we're actually going to be moving to the ear after that. So then on the eyes, we actually already did finish the Snellen chart, so for her near and distance vision for her cranial nerve 2. So then after the eyes, we're actually just going to go ahead and go to the ear. So on the ear, you're checking the auricle, the tragus, the auricle, the whole ear, the lobule, and then the mastoid bone. So I'm going to palpate the mastoid bone, make sure that's palpable in there. And so it's normal. And then her auricle is the correct size for her head. It is in the center. Tragus, once again, is lined up with the outer corner of the ear. I'm going to check both sides. So they are symmetric. Any tenderness? Okay, any tenderness on this side? Okay. Okay, there's no masses, redness, no drainage, no tenderness noted. Okay, so I'm going to take, I would take an otoscope if I had one. And what I would do is I would hold my pinky and the otoscope upside down, put that against sort of like her jawbone, and then pull her ear up and back to make sure that S shape is straight so I can see in her external auditory canal and her tympanic membrane. So upon inspection, we would want to see the buccal mucosa lining and make sure that there is some earwax and hair, which is normal in both ears, and make sure that you can see the external auditory canal and that it's clear, not obstructed, and there's nothing inside, no masses or lesions. And then you want to look at the tympanic membrane and make sure that it is like an opaque gray and that there is a light reflex at the 5 o'clock mark. So then after the ears, we've already done the ears, I'm going to do a whisper test. So then after inspection and palpation, so the whisper test is I'm going to whisper a 2-syllable word and she just needs to repeat it. So
Popcorn.
Okay, so she did repeat the words, so she passed the whisper test. And then after the ears, we're actually going to do the nose. So after the nose, we're just going to inspect it, make sure that it is midline. And it is, and then tell me if there's any tenderness. No tenderness. Okay, and then I did forget to go ahead and do the frontal sinus and the maxillary sinus along with the lacrimal glands. So we're actually going to go back and I'm going to make sure that this frontal sinus is not tender or swollen, any tenderness. Make sure the maxillary sinuses are non-tender and swollen, any tenderness. Okay, and then her lacrimal glands are actually the gland that produces tears. So we're going to go ahead and palpate those. And they are not swollen, any tenderness? Okay, good. So those are non-tender and non-swollen, which is normal. And then after the nose, we're actually going to move to the mouth. So her lips should appear like a pink, moist. They should not be chapped, not cracked or anything. And hers are not. So then we're going to actually have you open up your mouth. And I'm going to look at her teeth first. So her teeth should be, she should have around 28 or 32 teeth. 28 if you've had your wisdom teeth out, and 32 if you have not, depending on how much dental surgery you have. And then we're going to look at her gums, and her gums should be pink and moist. There should be no lesions or ulcers or tears, no abnormal findings in her. And then we're going to actually open your mouth, and we're going to look at the buccal mucosa, which is the inside of her cheek. And the inside of her cheek should be moist and pink and the same as her gums almost. And then we're actually going to look at her hard and soft palate, so open up. And her hard and soft palate is on the top of her mouth and the back and the top. So those are intact, and there is no abnormal lesions or color change or anything like that, no masses, and it looks moist and clear. So then we're going to check her uvula. So if you could stick out your tongue and say ah.
Ah.
Okay, and we want to make sure that uvula is midline and that it does raise, and that tests the cranial nerves to make sure that they do raise. That's cranial nerve 9 and 10. And then you check the tonsils, and her tonsils should be between probably a 1 or 2 is normal, usually 2, but in her seem to be a 2. So they are non-swollen and normal. And then after her tonsils, we're done with the mouth. So then after the mouth, we are going to move on to the neck. So her neck should be midline of her body along with her trachea. So you can palpate the trachea and make sure that it is straight and midline. And her thyroid should not be, you should not be able to see her thyroid on her neck, because that would insinuate a goiter if you could, which is a thyroid growth. So you cannot see that. So then on the neck it is midline, it is warm, same skin color, sort of like that olive tan as the rest of her body. And then after we check her neck, we're gonna palpate her lymph nodes. So first we are gonna want to palpate her preauricular lymph nodes. Any tenderness? Her postauricular lymph nodes. Tenderness? Her occipital, near her occipital lobe. Her cervical, or her cervical spine. And then her tonsillar, submandibular, and then submental. Any tenderness in any of those? Okay, and those lymph nodes should be freely movable and soft. They should not be hard or tender or not movable. They should be palpable. So all her lymph nodes are good, and then after the lymph nodes, we already palpated her trachea and made sure that that was midline. So then we are actually going to inspect her at a 45-degree angle of her neck, and we're going to be looking for her jugular venous pulse. And if she looks that way, you should only be able to see this jugular venous pulse if she's at this 45-degree angle, and that's normal on both sides. And then we should also be able to inspect and palpate the carotid artery. You want to palpate it for 60 seconds, make sure that's between 60 and 100 beats per minute on both sides. And then you can actually auscultate it. And you want to use the bell of the stethoscope. And you're going to be listening, deep breath in and out and hold. Okay, so she does that so that way you can hear if the arterial blood flow, make sure there's no bruise. So do one more time. Okay, there are no bruise noted, so that's good. And then we can actually move on to the upper extremities after her neck. So you can roll your sleeves up for me. And what we're doing on the upper extremities is her arms. So basically we're just making sure that her arms are symmetric, that they're same length, same size, and that they are non-tender. There are no masses, lesions, Tenderness, any tenderness?
Mm-mm.
Okay, and that her temperature is still warm and dry. The skin color should be an olive tan, still the same, evenly distributed around, and her hair should be evenly distributed on her arms as well. And then we're going to inspect her nails. So her nails should be smooth and flat, and there should be a capillary refill. So if you press down on her nail, it should fill back up with that blood flow at the end and turn back pink. So that's good. There's no clubbing or ridges in her nails. And then what we're gonna do is we're gonna go back and individually do each joint of her arm. So we're gonna do the shoulder joint. We're gonna palpate. Any tenderness?
Mm-mm.
Make sure there's no deformities or tenderness in her shoulders, in her elbows, and then her wrists. Any tenderness in any of those?
Mm-mm.
And we can go ahead and do her fingers if you'd like, and then we can do this shoulder. You wanna make sure they're symmetric. Just the are any tenderness?
Mm-mm.
Okay, and then tenderness.
Mm-mm.
Okay. Good. So there's no tenderness or deformities in her upper extremities. And then we're actually going to test for her full range of motion. So we're actually going to have her shoulder shrug first. So if you use shoulder shrug, that tests a cranial nerve. I believe that's cranial nerve 12, and that tests her shoulder shrug if she can do that. And then we're actually going to have her bend her elbows. And this is also going to test the range of motion, and then do her wrists up and down, back and forth, and circular, make sure that she has full range. Then her fingers, just make fist, unfist, and then make sure you can open your fingers and move them freely. And then we're actually going to have you rapidly do your hands, make sure you can do rapid movements, and then along with your fingers. Okay, and then you should be able to do all of these. That was without resistance, but with resistance you should be able. So if you can push, okay, so her elbow is strong. She's able to push and pull on that arm. This side as well. Okay, she was able to do that. We're gonna do the wrist, so push up, okay, push down, do the fingers, go ahead and do the fingers on this side, push down, and push up. Okay, and then we can do the wrist and fingers on this side. Push up, push down, and then do the fingers, push up, push down. Good, so she has full range of motion in all of her upper extremity limbs. So that's good with and without resistance, and they are symmetric and evenly colored and everything like that. So then we're gonna move on. If you can take your shirt off, we can do the posterior thorax. So on the posterior thorax, we're actually inspecting first and palpating. So we want to inspect and palpate and make sure that her skin is warm and dry still, that there's no abnormal masses or lesions or growths of any kind. You want to check the AP to transverse diameter and make sure that that is still 1 to 2. And then you're also wanting to check chest expansion and make sure her chest expands when she breathes, along with crepitus and tactile fremitus. But we're not actually going to perform those. And then after you inspect for temperature, masses, lesions, and all of that, we are actually going to auscultate. And this is when you want to use the diaphragm. And there's 20 positions, and you would have the client breathe in and out for each 20 position, but we're just going to show you the positions. So you start up at the top. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. Okay, and then for those you would want to be making sure that there are no adventitious sounds, no crackles or wheezes in her lungs, and make sure that they are clear and not obstructed. And then after you do the posterior thorax, you want to move to the anterior thorax, so the front. You want to make sure her sternum is midline, which it is. You want to make sure there's no use of accessory muscles on her posterior and anterior. And you also want to do crepitus and fremitus on the front as well, and make sure there's no masses, lesions, or anything like that. And then make sure her temperature is warm and dry, and her skin color is sort of that olive tan that she has been showing throughout the whole examination. And then on this, you want to auscultate next after you inspect and palpate. And this time it's 10 positions, and you start above her clavicle the first time. And the client would breathe in and out for each position. Okay, and those are the 10 positions that you would want to auscultate, and you'd be listening once again for crackles, wheezes, any adventitious sounds in her lungs, but hers are clear and would be clear since she's healthy. So then after the frontier thorax, we're actually going to have her lay it at 45-degree angle, and we're going to be checking once again her jugular venous and carotid artery, make sure those are normal. And then we're actually going to have you just look that way. You can palpate it once again and auscultate it. Do that again. It is present and it is not quite bounding, but still strong. And then we can actually have you, we're actually going to test your next 5 heart sounds. So her 5 heart sounds we'll be listening to with the diaphragm and the bell. So there's 1, that's aortic, pulmonary, Erb's point, tricuspid, and mitral apical. And you want to do that with the bell as well. Okay, and you're listening for any adventitious sounds, murmurs. You're listening for S1 or S3 and S4, S1, S2 together, and S1 and S2 separately in that. And then we're actually going to have you lay down. And I'm going to look at her apical pulse. So first you want to inspect her apical pulse, and she's going to lay on her left side. And it's going to be right under here, and you're going to want to inspect it and make sure that you can see the apical pulse as well as palpate it, and you would be palpating it for a full minute. And then it should be between 60 and 100 beats as well, which hers was. And then you can auscultate it with the diaphragm and the bell if you want. Use the bell. Okay. And then we can use the diaphragm. Okay. And you're listening for those adventitious sounds, which she does not have any, and you can actually just lay flat on your back. And next we're going to be doing the abdomen. And you actually want to auscultate the abdomen first, because you don't want to mess up any bowel sounds that are in there. So you can use the diaphragm. This is her right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Okay, good. And you should hear bowel sounds, which is normal. And you want to stay there for like about a minute until you hear bowel sounds. But since I already heard them, we can move on. And next you want to palpate. You want to lightly palpate first in each quadrant, in all 4 quadrants. So any tenderness? Okay. And after inspection, after you inspect that there are no masses or lesions or note any abnormal findings, abnormal pulsations and stuff, you want to make sure that you do palpate lightly and deeply and make sure that her temperature is warm and dry and that her skin color is this, consistent with the rest of her body. Usually the stomach's a little bit lighter in skin color, so that's normal. But was there any tenderness in lightly palpating? Okay. And you want to deeply palpate, and you want to deeply palpate in the same spots, all 4 quadrants. Tenderness. Okay. No tenderness, no tenderness. Okay, so there is no tenderness noted, which is good, and their bowel sounds are active, so you can sit back up. You can raise back the seat. And then after that, we're actually going to be doing her lower extremities. You can put on your shirt if you like. Okay, and with her lower extremities, we're wanting to test to make sure, inspect that her legs are symmetric. They are the same length. And they seem to be the same length. Make sure that they're warm and dry as well. Make sure that they are smooth. No swelling. Any tenderness? Tenderness in the side? Tenderness down through here and in her feet. So she says there's no tenderness, which is good. And then there are no masses or lesions, and temperature is warm and dry, as well as color is consistent. And then what we're going to do next is we're actually going to take her popliteal pulse, and that's behind her knee. So behind her knee, you want to get the pulse, count it for a full minute, and it should be within 60 to 100. And do that with the same on the other side, her right side. And you want to make sure those are even and within the 60 to 100 limit. And we're actually going to do the dorsalis pedis pulse, which is on top of her foot. And you want to make sure that is also within 60 to 100, which it should be. And then you're going to do the posterior tibial pulse, and that's sort of in between her Achilles, sort of in the back medial side of her foot. And that is present in both. And then we're actually going to go ahead and look for at her toenails. If she didn't have nail polish, you could be able to see the capillary refill like we did in her fingers. So you want to test that and make sure that there's no clubbing or ridges, that it is smooth, pink, and then that capillary refill does fill up within 2 seconds. So then we want to go back and we want to check for edema. So there's no edema noted in her legs, no swelling, edema is swelling. And then we're gonna go to each individual joint. So first her hips. And there's no swelling, any tenderness in the hips or knees? Okay. Ankles, any swelling?
No.
And feet, let's go ahead and do the feet. And we'll go back and do this side. Any tenderness? Okay, and there's no deformities, no tenderness, no swelling, masses, tenderness. Okay, and no tenderness in the ankles, and then in the feet and toes. Okay, and there's no swelling. And then we're actually also going to be doing a full range of motion test. So here we're actually just going to be stating it, we're not going to be performing it, but she would be doing full range of motion with and without resistance. And we're going to have her stand up. Okay, and then we're going to be checking her spine next. And her spine, you just want to make sure that it does have that slight curve, that it is not too much of an S curve or just flat. So hers is normal, so she does have that curve from the back and the side. And then we're actually going to be feeling her vertebral processes, which is her spine. You're going to be feeling to make sure that is straight, which hers is. And you're going to be feeling the paravertebral muscles beside her spine. Any tenderness? Okay. And then we're going to actually have her bend over and make sure that that spine is straight. You want these lumbar spine to flatten out sort of, and then make sure there is no sign of scoliosis or the S shape of her spine, which there's not. So she is all good on that. You can stand back up. And then we're actually going to do a walking test. So if you can just walk straight. We're testing her gait to make sure that she is steady. And she is. Okay, and then we're going to actually have her do heel to toe as well. And this tests balance. And that is clear. She can balance, so we're good on that. And then the next one is a Romberg's test. We're just going to have you stand there and close your eyes. And we're testing for any swaying, abnormal swaying, which there should be a little bit, that's kind of normal, but she is not abnormal in that. So then we're actually going to do an arm test. So we're going to do finger to nose. We're going to test those. And then do it with your eyes shut. Okay, good. So then she passed that, and that is it for the full head to toe assessment. Now I would do hand hygiene and then be done.